Hi friends, today we are going to discuss about the treatment modality for lymphoma. There are many doctors and specialists who treats lymphoma, but commonly it is treated by hemato-oncologist or a hematologist like us. Lymphoma treatment has got a sea change. The way your mobile has gonna see change, the way your cars have gonna see change. Similarly, lymphoma treatment has become more aggressive, more targeted, less expensive, and less of side effects. That is very, very important, which all of us has to remember. In 2018, even the layman need not be scared about chemotherapy. When the word blood cancer comes in, when the word lymphoma comes in, we are scared of three things: cost, death sentence, and the side effects. We know in lymphoma, together we can win. 70 to 80% people can be cured for long term, means 20 to 30 to 40 years. Chemotherapy has become less expensive. The rituximab, which we used to give for 1 lakh rupees injection 10 years back, now has been sold at 30,000 rupees for every time. So you see how the cost has became a less of a barrier. And then the side effects. In 2001, we were giving a pan bomb. We were giving everybody chop so that we were killing all the cells. While in 2018, we have got targeted medication. So we learned that we have got Hodgkin's lymphoma, we have got non-Hodgkin's lymphoma. In Hodgkin's lymphoma, there's a brentuximab, there's a nivolumab kind of a therapy which has come for a relapsed refractory Hodgkin's lymphoma. ABVD has become the standard of care for every Hodgkin's lymphoma, but what it leads, that more of supportive care, more of antiemetics or vomiting preventive medicines have come up, so that less than 5% people now have got nausea and vomiting while taking a treatment called ABVD in Hodgkin's lymphoma. The treatment cycles depend upon what stage you are in. Stage 1 and stage 2, very good, only 4 cycles to 8 cycles. Stage 3, stage 4, 12 cycles. And a PET scan has to be done after 2 cycles of chemotherapy, which entails that 90 to 95% people will be alive and surviving if your PET scan after 2 cycles is negative. Non-Hodgkin's lymphoma, as we know, is a B cell or a T cell. We need to know the subtype. That is very, very important for have a lymphoma pathologist and have a second opinion onto it. Why? Because the reason is, if it is diffuse large B cell lymphoma, means B cell lymphoma, 60 to 70% people will be alive by giving a targeted medication called rituximab, which is less expensive now, which is more affordable for people now. It is follicular lymphoma, 2 years, every 2 months you have to get rituximab so that you have a progression-free survival, means you live longer without a disease coming back. And even if the disease comes back, it might come back in 2023, where we'll have more molecules to cure you at a more affordable price. If it is mantle cell lymphoma, more aggressive therapy needs to be given. So histological subtype of what kind of a lymphoma is very, very important. If it is T cell lymphoma, CHOP plus etoposide remains the standard of care in majority of T cell lymphoma, and majority of drugs, still investigational drugs, are coming to India at a rapid pace. What the highlighting point on this 15th of September is that lymphoma is curable. What we need at this present moment of time, more of healthcare awareness about abnormal and normal within our own body. Go to a doctor like hematologist or hemato-oncologist like us to get an early diagnosis and a correct diagnosis so that we can cure you at a minimum price with minimum chemotherapy with minimum side effects. So what my request is, lymphoma is curable. Let's join hands to make people aware about lymphoma and save more lives.